everybody. For those who don't know me, I'm Harry Nonez, PGY2, and today I'll be talking about psychological first aid. I want to give a shout out to the disaster team who helped make this possible. So first, we're gonna just talk about the outline of today's presentation. So I'm going to talk about what is psychological first aid, how to deliver psychological first aid, the impact of COVID-19, the concept of the worried well, how to treat the worried well, impact on physicians, and summary. So let's first talk about what is psychological first aid. It's a supportive intervention used with children, adolescents, parents, caretakers, family, adults, and even first responders in the immediate aftermath of a disaster and or terrorism. What is it not? The purpose of psychological first aid is to assess the immediate concerns and needs of an individual after an aftermath of a disaster, and it's not to provide on-site therapy. So we'll start with the case. Do we know how to make this? If you go over here.
Oh, I'm sorry, man.
No problem. So basically, this video is just like a 30-second clip of an earthquake that happened in a third world country. And I just wanted you to put yourself in that position. Just imagine feeling all the shaking and you just enjoying your time. This clip was in a store. The next clip was inside of an airport where hundreds of people were just running around, frantic, ceilings coming down. So I just wanted you to put yourself in that position. So you hear that a large earthquake has suddenly hit the center of the city in the middle of a workday. Many people have been affected and buildings have fallen. The extent of the damage is unclear. The agency you work for has asked you and your colleagues to help survivors and to support any severely affected people you encounter. So after this lecture, if you were ever put in a situation, the goal is to know how to apply psychological first aid in this situation. So the people that you'll be taking care of will feel like an earthquake just happened in their brain. Basically, all the emotions, all the worries, all the thoughts of what's going to happen, where's my family, is running through their head. And it's up to you to apply the following concepts. So first, it's going to be contact and engagement. You need to respond to encounters initiated by survivors and to initiate encounters in a non-intrusive, compassionate, and helpful manner. Your first priority is to respond to those who reach out to you. If a number of people approach you simultaneously, your goal is to make contact with as many individuals as possible. You do not interrupt conversations. You don't assume that people will want to respond to your outreach with immediate positive reactions. The next, the next is safety and comfort. You need to enhance immediate and ongoing safety and provide physical and emotional comfort. Examples include giving information about what to do next, what is being done to assist them, what is known about the current event, what are some available services, and it also includes connecting with loved ones. Next is stabilization. If this is needed, you do this by calming and orienting emotionally overwhelmed or disoriented survivors. The next is information gathering, and you do this by identifying immediate needs and concerns and gather additional information, offering practical help and tailoring psychological first aid interventions. Coping. You do this by providing information about normal stress reactions and normal coping to reduce distress and promote adaptive functioning. Lastly is connecting with social supports and collaborative services. You do this by linking survivors with primary support persons and other uh, sources of support, including family members, friends, and community helping resources. What are some of the do's and don'ts? What you should do is to promote safety. You help people meet basic needs for food and shelter and obtain emergency medical attention and how to get these basic needs. You need to then promote connectedness. You need to help people contact friends and loved ones and keep families together. You can then promote calm. Listen to people who wish to share their stories and emotions, and remember that there is no right or wrong way to feel. Offer accurate information about the disaster or trauma and the relief efforts that are underway. You need to then promote self-efficacy. You need to give practical suggestions that steer people towards helping themselves. You need to engage people in meeting their own needs. You then need to promote help. Find out the types and locations of government and non-government services and direct people to these services that are available. And when they express fear and worry, let them know that help is on the way. What are some things you should not do? Some behaviors that you should avoid is do not make assumptions about what survivors are experiencing or what they have been through. Do not assume that everyone who has been exposed to disaster actually wants to be helped. Um, do not assume that all survivors want to talk to you or need to talk to you. Often being just physically present is enough and it can actually be enough to calm them. Do not pathologize. Most acute reactions are understandable and expected given what people have been exposed to and the disaster that they've seen. Do not label reactions as symptoms or speak in terms of diagnoses, conditions, or disorders. Do not talk down or to patronize a survivor or focus on his or her helplessness, weakness, disability, but instead focus on what they've done so far that can help others and what they've done that can like help others both during the disaster and in the present setting. Lastly, do not speculate or offer inaccurate information. If you cannot answer the survivor's question, do your best to learn the facts. And at this point, I would love some audience participation. If anyone can say some of the things they've done to promote safety, connectedness, calm, self-efficacy, or help during a disaster or non-disaster situation, whether it's in person or online as well.
I think in my experience, I don't think I've had too much experience with a specific disaster, but in just these type of situations, listening and not interrupting, kind of like you said, letting the person tell their story can go a long way. I think as physicians, we just tend to want to interrupt and to inject our opinions, and often listening and allowing the person to get everything out is more effective and sometimes a lot more time saving.
Agree. Even for myself, sometimes just like sitting down, not standing over the patient, sitting down and how you talk, how's your voice is, you know, like calming voice can definitely help them talk more or just feel better about the situation. So my next slide also would need some audience participation. I would love to know what comes to mind, some of the thoughts that come to mind when you see these two pictures.
2020.
Agreed. Anyone else? Okay, so if you ask me, I see helplessness, I see sadness, I see loss, I see anxiety, depression, I see overwhelm, someone who could be overwhelmed. But in honesty, this is what COVID brought in 2020, and it's a reality that we have to face. So let's talk a little bit about COVID. So January 9th, the WHO announces a mysterious coronavirus-related pneumonia in Wuhan, China. In January 21, CDC confirms the first US coronavirus case. On March 11th, the WHO declares COVID-19 a pandemic. 6 months later, July 7th, the US surpasses 3 million infections. And as of a week ago, globally, there's been about 239,437,517 cases and more than 4.8 million deaths. The COVID-19 pandemic has been linked to a great deal of anxiety, exacerbation of mental illnesses, social isolation, feelings of helplessness, and abandonment in various populations. People in quarantine who are not equipped with self-care and coping strategies often feel lonely, socially isolated, find it difficult to handle all the information that's being thrown at them. It leads to poor sleep, poor nutrition, lack of exercise, substance abuse, excessive usage of the internet. And I remember for myself, during COVID, seeing all the news media coverage of like all the body bags being, put behind the hospital. These types of images can lead to, unpleasant emotions of fear and anxiety. And then the precariousness of this current scenario, the isolation, the unhealthy lifestyle, and overload of all this information leads to chronic stress. This may act as a trigger for health anxiety in susceptible individuals and may worsen pre-existing mental health conditions. So I think this segues great into this next part, which is the worried well. So you may ask, who are the worried well? These are usually healthy individuals with less severe concerns about their health. They tend to be focused on specific undiagnosed illnesses or vague symptoms that they think represent a significant disease. And with everything online, I'm sure you can type in a symptom and you get a whole bunch of random and rare and frightening diseases, thanks to Dr. Google. These people tend to be hypervigilant to internal and external body processes, and any benign sensation can be perceived as a symptom. Worst of all, symptoms arising from stress, insomnia, withdrawal from alcohol can also be ignored. This then leads to requests for specific testing, such as x-rays, CT scans, or consultations that the patient wants to help reassure them to make sure that they don't have the said condition. So in addition, like pre-existing mental illnesses, poor experience with healthcare systems, past like childhood sexual abuse, familial conflicts, marital discord, can all make an individual more susceptible to develop these distortions. I remember for myself when COVID first started happening, obviously I was a fourth year and match just happened. We all went out to celebrate and a couple of us got COVID, right? So they said, back then they were like, oh, the first week you'll get the cough, the second week, the shortness of breath, and then sometimes people just end up passing away from that. So after I got the cough, it was about day 5, day 6, and then I'm like, okay, maybe the shortness of breath is gonna come. I'm a fourth year medical student at this point. I know what shortness of breath is. I know how to see it. But I remember like day 5, day 6, I'm calling my wife. She was in New York at the time. And I'm like, hey, would I know if I'm short of breath? Like, how funny is that, right? Like, I know what it is, but at this point, with everything going on in the news media, I'm like freaking out. I'm like, oh my God, am I going to be short of breath? Am I going to not wake up in the morning? So yeah, it's just this basically show you that you can become the worried well. It's not like it's not specific to any certain type of people. So how do you treat the worried well? The most helpful thing you can do is acknowledge the reality of their concerns and try to better understand the worries that underlie them. Do this by getting a good history and physical examination. Talking with your patient, touching your patient can not only helps confirm the disease is not likely present, but also conveys to them that you're taking their worries seriously. It is important to communicate that you are partners in health and to avoid the inference that their symptoms and feelings aren't real or that they're trivial. And talking more in depth about what they're experiencing can provide valuable insight to their concerns. What you should not do. Obviously, the most quickest action is to simply order the tests that they want. And research actually shows us that doing this doesn't actually provide much reassurance to them, but it can expose them to like significant risks. And I know for myself, I've definitely done it before and got the x-ray to just show grandma that her ankle is okay and it's not broken. Um, but again, this is something that we should try to just lessen more and more as we continue with our practice. All right, so let's talk about the impacts on us as physicians. I would love some participation for this as well. Would anyone want to read this quote by one of our previous doctors here?
Family is unshakable and fearless, which is what our patients in the world need right now.
So this is the mentality that most of us went into residency with and was in the back of our mind during this whole epidemic. Next. Someone else wants to read this one?
I'm broken, completely helpless. This is just too close.
During epidemics, healthcare workers are susceptible to significant psychological stress related to exposure to disease, concerns about transmitting the infection to their families, shortages in PPE, long working hours, and challenging decisions regarding the allocation of limited resources to their patients. The overall prevalence of anxiety and depression among healthcare workers during the COVID-19 pandemic was 24.9% and 24.8% respectively. Previous experience has actually shown that healthcare workers are unlikely to seek out emotional help. During the SARS outbreak, healthcare workers did not seek out formal mental health support, um, but they did benefit from peer support when it was available. And same thing was shown in a study in China during COVID. Staff showed a marked reluctance to participate and refusal to accept help despite showing irritability, unwillingness to rest, and other signs of psychological distress. However, when counselors were available in the rest areas where the healthcare workers were, the staff spontaneously voiced their experiences as a form of stress relief. I know even for us during lots of like conferences and even on our group chats, people often talked about like the sad stories they had and even the triumphs. So common stress reactions. It's definitely like normal for us providers to have these types of stress reactions. The most common ones include an increase or decrease in activity level, difficulty sleeping, substance abuse, irritability, anger, frustration, depressive or anxiety symptoms, decreased social activities, acting out, withdrawal and isolation, and serious difficulties in interpersonal relationships, including domestic violence. But there are options to reduce these. You can do this by limiting shifts so that providers work no more than 12 hours and encourage work breaks. You can rotate providers from places where they're most likely exposed to this to places where it's there to a lesser extent. You can mandate time off. You can encourage peer partners and peer consultation. You can establish supervision. You can establish more staff appreciation events, and you can conduct trainings on stress management practices. But what we can specifically do for ourselves includes maintaining boundaries, delegating tasks, being okay with saying no, avoiding working too many survivors in a given shift, perform regular check-ins with colleagues, families, and friends, take relaxation, stress management, do bodily care, and take refreshment breaks. Try to be flexible, patient, and tolerant, but most of all, accept that you cannot change everything. So to summarize, we're back at the site of the earthquake. As you prepare to go in, ask yourself the following questions. Are you ready to help? What personal concerns might be important? What information do you have about the crisis situation? Will you travel alone or will you travel together? Things to consider. You need to consider the advantages of working in a team. Working in the team increases efficiency and provides you with support and backup. Some agencies may even able to give you support such as supplies, transportation, and equipment that you'll only get if you work in a team. As you move about throughout the city, what should you look for? You need to figure out, is it safe to be at the site where you are? What services and supports are available? Are there people with obvious urgent basic needs? And are there people with obvious serious emotional reactions? And who may be more likely to need special help? As you approach people, how can you best listen to their concerns and give comfort? How you identify and introduce yourself to offer support? How will you ask people about their needs and concerns? And how will you best support and comfort these affected people? And I feel like if you can answer any of these questions or all of these questions, you are more than ready to give psychological first aid. Thank you.